Hi, folks. We are back, and this is the final workshop of the weekend. And boy, did we save the best for last. We have a nationally renowned speaker here for you today, Dr. Jaquel Patterson. She's the CEO and owner of Fairfield Family Health up in Connecticut. So it's probably a little colder up there than it is here. How about that, Dr. Jaquel? Is it a little cold up there?
Yes, but I'm actually in Vermont, and it
Ah,
snowed here 5 inches. I came at the wrong time, so
well, you know what? Anytime you go to Vermont, that's likely to happen.
exactly.
You're right. But Dr. Patterson, as I said, is a renowned speaker. She's been speaking in our industry now for some time and sought after. We're lucky to have her here today. And what a topic, tick-borne disease, neuroinflammation. I mean, if we know, the talk of heart disease and metabolic syndrome and they're all over the place. But one of the fastest rising disease states in this country is neurological, neuroinflammatory conditions. So we have the best, we have the expert. Dr. Jaquel, take it away.
Thank you so much, Joe. Thank you, everyone, for being here. Good afternoon. As Joe said, I'm based out of Connecticut. I've been a naturopathic physician practicing for 16 years, also an Amazon bestselling author, one of the books called Women in Lyme, and also past president of our national association, American Association for Naturopathic Physicians. So I am really excited to talk about tick-borne diseases, its impact on psychiatric conditions, and neuroinflammation. I actually can't access sharing the screen, so I know Phil is going to do that now. Okay, great. Okay, so this information, comments, and opinions expressed in this presentation are those on my own and my own clinical experience, as well as interpretation of the literature for educational purposes. I do present, as Joe had said, for many different nutraceutical companies, love and use many of the products from Nutritional Frontiers, and also serve as faculty for several different groups, including Rupa and Psychiatry Redefined. So as we already mentioned my experiences, and one of my areas of focus is Lyme disease. I am obviously based out of Connecticut, which is Lyme Central. But as what we will discuss is there really are cases throughout the country. I see people in Texas, I see people in Florida, I see people in the Midwest with Lyme disease and other tick-borne diseases. It's on the rise. If you look at some statistics by, for example, NIH, Babesia, which is one of the common co-infections, has risen and grown since 2015, 10 to 15%. And there was about $30 million of funding last year alone just to start investigating Lyme disease more because of the amount of additional subspecies that are existing as this is climbing, because the climate is warmer. It provides a feudal environment, a good ideal environment for reproduction, and it's only going to continue to grow. So have you ever wondered? So what we're going to talk about is we're going to talk about a lot. So that's the first thing. So we're going to talk about factors for neuroinflammation. What are some of the causes for neuroinflammation? There are many factors, but bacteria, fungi, and also infections like Lyme disease are key factors to cause disruption with the brain, which can cause these psychiatric conditions, or actually either worsen or potentially be an initiating factor. So we're going to go to a deep dive into that. And also, if you look at the stats since 2020, the rates of mental health have even increased, specifically, even more specifically for young adults, in terms of anxiety being about 1 out of 3 kids with anxiety having a diagnosis, and about 1 out of 4 for depression. So it's something that as clinicians, we can't avoid, but what we want to look as people trained in integrative medicine, what could be all the potentially leading causes that is either leading up to causing a mental health condition or maybe worsening it. Okay, so there's a complex interplay. So the interplay between there's a few things on it. Yeah, inflammation. That's what we're going to talk about at first. Immune dysfunction, and then its relation to psychiatric conditions. So the next slide, you're going to see the agenda. We're going to talk about Lyme disease, tick-borne diseases, and the mechanisms of inflammation in the brain. what the impact of inflammation is on neurotransmission and circuits, and also the relationship between autoimmunity and psychiatric conditions. So you'll often see with tick-borne diseases or other infections, they are connecting it to an initiating factor. Actually, in fact, most people with autoimmune conditions will have one or two chronic and persistent infections prior. And so working on those might help to potentially even prevent the onset of an autoimmune condition or help with management of an autoimmune condition. Then we're going to talk about contribution of inflammation to specific psychiatric conditions, related inflammatory biomarkers when you're looking to evaluate and support the case, the role of inflammation in treatment resistance. So higher levels of inflammation actually will lead to greater rates of things like even schizophrenia. The focus areas we're going to talk about today will be anxiety, depression, and schizophrenia, and then therapeutic strategies that are going to target inflammation in psychiatric conditions. So overall, Lyme disease and other tick-borne infections, if you look at the stats, there are about 500,000 people diagnosed every year with Lyme disease. And we actually think that number is a lot higher. And the reason is a lot of people do not get worked up for the case. They do not get diagnosed. And so we expect that number to be closer to 1.5 to 2 million. If you look at the stats, the warming climate has increased its emergence, and Lyme population has actually doubled since 1991. And in the past century, the number of new infectious disease each year has actually quadrupled, with yearly outbreaks tripling. The transmission time on average is 36 to 48 hours. However, some, like Powassan virus, can transmit as soon as 15 minutes. And that's really important to note because I have patients, they'll go hiking, they find, a tick and they say, well, there's not a problem. It's only been on for a couple hours, but they are finding with some species, they may actually transmit it much faster than expected. So the 36 to 48 time is average, but that is not always the case for every case. So it's known as the great imitator. The reason is that it can look like many different illnesses, and only through testing can you know for sure. However, even with testing per CDC, it's still a clinical diagnosis, meaning you shouldn't base that off only the test. And the reason I say that is many patients will have, they might have, let's say, IgG, or they have a few bands, or they've struggled with Lyme disease for a long period of time. It needs to be matched up also with clinical symptoms, not purely based on the laboratory workup. Also, as we know with some of the testing, especially if you're not getting it from a Lyme literate lab vendor, it may only test for what's called Borrelia burgdorferi B31 when there's many different subspecies. There could be, on some tests, they might test for 8 to 12 different subspecies. So when you're testing through the conventional labs, you may miss out on some of these other subspecies. And it's one of the reasons with the conventional labs, it's over 50%, some say 56% false negative. So Lyme disease and co-infections are spreading. If you look at infections overall, with Lyme disease, about 40 to 50% will have more than one infection, including Lyme and Bartonella or Lyme and Babesia. It has been shown to be present in almost all 50 states. So if you look at this map here to the right, you can see the positioning and then and throughout the country. So definitely less in the Middle West, but you see more on the borders, and definitely Lyme disease more prevalent. Okay. So let's just go through, because I know everybody's at different experience levels when we're talking about Lyme disease. So I wanted to do a brief overview first before we dive deep into it. So when you get, the most common thing that people know is the erythema rash. But just to know, many people, almost half people do not actually have a bullseye rash. It can take from 3 days to 30 days to show. It typically takes around 7 days, and it can spread as much as 12 inches. And some individuals even can have multiple tick-borne or multiple bullseye rashes. I've even seen when I've treated patients and they start getting better, never having had a bullseye rash, their bullseye rashes will start coming up as they start getting into being cured. So it also, some things in terms of the position of it, it's warm. It's not usually itchy. And basically when they look at it as a bullseye rash, it clears as it gets larger. But some people can present differently. It can almost look like a spider bite. It could be in one area. So it doesn't always show like a bullseye rash. And that's important to note, because that's also another reason why people might not, doctors, when they're actually working it up, might diagnose it correctly based on the skin as well, if they're looking only for a bullseye rash. So some of the signs and symptoms. So one of the biggest symptoms is joint pain. And what you'll see is more migratory joint pain, as opposed to things like rheumatoid arthritis that will stay like localized in the wrist or the hands or the feet. With Lyme disease, you'll see kind of some bouncing around because the spirochete is moving. I myself had Lyme disease, Bartonella, and Babesia. And one of the things you'll always hear patients say with it, that they feel like it's in their head, because one day my arm, my shoulder would hurt really bad, and then the next day it was gone, and then my ankle would hurt. And so you feel, as a person experiencing it, as though you're actually like, can this be real? And then sometimes often it's also disregarded in medicine. And so again, bullseye rash, only close to 50%. It can mimic a spider bite. Muscle pain, joint pain, headaches. You can get brain fog, memory issues. Patients will say they feel like out of it. And one of the challenging issues is, let's say a woman is going through perimenopause or menopause, or after pregnancy, or any hormonal issues. Those symptoms can also show if there's hormonal issues. So you have to delineate all of that, as many of the symptoms can present similarly. And also, when it's more advanced, you can get neurological symptoms like numbness, tingling, tremors, and also things like blurred vision and what they call ocular convergence. Some common co-infections, so ones that are most common, are something called Babesia. And so with Babesia, you'll see, and you can also see these same symptoms with Lyme, undulating fever off and on, where you will have, you feel ill, where someone will say like, I feel like I keep feeling like I'm getting sick or flu-like, but they're not really sick. Profuse sweating. That was one of the things I had, where I was like completely drenched for no reason, not related to stress. Sweating, people will get palpitations. They'll even get what's called air hunger. So it's not like they have asthma, but they'll have shortness of breath doing simple things, where they say they feel like they can't take a deep breath in. When you look at things like Bartonella, that affects more the neurological system, where you'll have dizziness, balance issues. Patients will say they feel like they got off a boat, like they're still swaying. You can have like actually pain on the bottom of the feet, almost like plantar fasciitis. I've had a lot of patients with that. And when we've worked on the tick-borne infection, that's completely went away. Also, it's often connected with another disease called PANS and PANDAS, common that has seen in children, that can cause neuro manifestations of anxiety, OCD, tics, etc. Also, Anaplasma ehrlichia is another common one, and Rocky Mountain spotted fever. And when you look at things like anaplasma, commonly comes with horses. So really look at the patients you have and what their exposures are, like farmers, hikers, hunters, things like that. And that can also help as you're looking at the diagnosis. Okay, so how is this related? How is Lyme disease? How are tick-borne diseases? How do they cause inflammation in the brain? So if we look at the mechanisms, there's many different triggers for what we call neuroinflammation. So infections are one. So you have bacteria, virus, you can even have like fungi that actually invade the nervous system, and they trigger an immune response. So you definitely need to, because of that, rule out, you really want to rule out any active infections. Also, other reasons: TBIs, toxic exposure. So things like lead, cadmium, air pollution, which arsenic is high in, and also pesticides. So these toxic exposures also cause neuroinflammation. Also, as we know, metabolic disorders, type 2 diabetes, anything that's chronic low-grade inflammation is causing neuroinflammation. Autoimmune disorders, because of this attack on the healthy tissue of the nervous system. Chronic stress, so high cortisol over time, will also cause inflammation, or promotes inflammation at a higher level, and has been implicated in depression and anxiety. And then obviously things like ischemia, stroke, which reduces the blood flow to the brain, and then what they call inflammation, so aging over time, just this chronic low-grade inflammation that will cause neuroinflammation as well. So if you look at the so what happens initially? So you have your blood-brain barrier. And so what the blood-brain barrier does is it helps to separate the brain from peripheral circulation. It's composed of glycocalyx, endothelial cells, parasites, and also astrocytic end feet. So what happens is this barrier can get weak. So for the most part, this everything will be prevented. About 98 to 100% of solutes actually fail to enter through this tight barrier of the endothelial cells. However, if there's this chronic inflammation over time, the barrier can become more basically permeable. And this disruption can cause ion dysregulation, edema, neuroinflammation, which then leads to this neuronal dysfunction and also increased intracranial pressure. And so this is just the picture there. And then if you look at what the disruption looks like, yep, we can go to the next slide. So blood-brain barrier disruption. So on the top, you have the healthy state. So the healthy state, you have change in signaling, you have this white, and then what happens is after it gets continually disrupted, you have this white blood cell, the leukocyte traffic that and solute leakage that goes through. Again, I had mentioned like 1 to 2%. And then you get the structural damage. So if you see on the top, this is the healthy state of a brain. And you could see on the bottom, systemic inflammation, where you have this solute leakage to the brain, which thereby causes neuroinflammation. Okay, you'll just have to keep clicking here, sorry. So, so a high level of systemic inflammation, as I mentioned, there's signal changes that increases cellular traffic and solute permeability, and you have this direct damage. And these endothelial cells, the endothelin, also respond. You have this inflammatory response, and there's a response to inflammatory mediators like interleukin 1, 1 beta, IL beta, IL-6, tumor necrosis factor, as well as cyclophilin. And what is infection's role? There are, when we look at what is the direct role, and what are some of the studies showed? So there is a connection between viral disease and anxiety and depression, particularly when you look at the studies, influenza, other influenza viruses like varicella zoster, HSV, HIV, AIDS, and hepatitis C have actually been connected with things like Parkinson's and Alzheimer's. COVID-19 infection, after you've seen, especially after that in 2020, you've seen increases in things like Guillain-Barré, MS, also type 1 diabetes with individuals that have had also COVID or have struggled with COVID symptoms. So tick-borne diseases overall has shown support of systems of significant anxiety and depression months and years post-treatment. So continued, they call it post-treatment Lyme disease, where someone will have continued symptoms after being treated with antibiotics. Also things like PANS and PANDAS, which is connected to things like strep, mycoplasma, and also tick-borne diseases, including things like Bartonella. And then also parasites and bacterial infections. Those can also contribute to mental illness by influencing this neurotransmission pathway and impacting the immune function. So some studies have shown things like Taenia sodium and also Toxoplasma gondii. So Toxoplasma gondii infection has been connected even with schizophrenia. So if you look overall, what's the infection and during the infection, there's basically this increase. I mentioned the endothelial cells, but there's this increase in neuroinflammation because of this altered presence of endothelin 1. And I mentioned endothelial cells, when there's inflammation increasing up those inflammatory mediators like IL-1 beta, tumor necrosis factor. And these are mainly produced by endothelial cells, and they basically help to maintain the integrity of the blood-brain barrier that we discussed. So when there's inflammation chronically, you'll see this increase, there's an altered presence. So there's a higher amount of things like endothelial 1 that increase up to actually protect the barrier of the brain itself. These are some other infections connected with neurological conditions. So you have H. pylori connected in terms of there's list there of how they affect an E. coli, blood-brain barrier invasion, chlamydia pneumoniae cause blood-brain barrier alteration, Mycobacterium tuberculosis. So these are some other types of infections. Also Porphyromonas gingivalis. I can never say that one fully, but that one has been completely studied, particularly with things like Alzheimer's and Parkinson's and other neurodegenerative conditions as well. So we have the blood-brain barrier disruption, as I mentioned. So that's the first piece, right? So we have the blood-brain barrier disruption of the CNS, and then what we have is this activation of microglia. This is part of the CNS. So we also have astrocytes that get impacted, but what you'll see as a hallmark of brain pathology is this activation of what's called microglia. And what microglia do is they serve as brain macrophages, and they help to mediate neuroinflammation. So I always say they come in and they're basically cleaning things up, if there's chronic or constant inflammation. The challenge is if you have to continue to clean things up, their body is just mounting this chronic inflammatory response. So being Hive that's constantly activated, the reason it would be activated is because there's a lot of inflammation going on, right? And it's having to work more to clean out the debris and help to mediate this neuroinflammation. So it's expressed across a wide array of immune receptors. It's expressed on what's called the PRRs that detect what's called PAMPs. So these PAMPs are pathogen-associated molecular proteins, or what they call tissue damage associated molecular proteins, DAMPs, which are connected with like viruses like TLR4, TLR1, and they also are expressed upon what's called the chemokine receptors. And these are expressed upon many receptors for neurotransmitters, including things like GABA, dopaminergic, and also the cholinergic receptors. And there needs to be a really good balance. When GABA, for example, and glutamate are imbalanced, there's going to be higher levels of these psychiatric either aggravations or conditions. Next. Okay, so this is how neuroinflammation works. So we do need, I always remind people, we do need some level of inflammation, right? Because inflammation actually helps acutely. If you cut yourself, you want your body to act and actually go out, prompt an immune response and heal. The challenge with it is if it's the not only the is the duration. So if there's continued inflammation and also the intensity. So if there's a high level of intensity as well as duration, that is key to its impact on whether immune signals are either supportive or destructive. So you'll see on the left side the positive aspects of neuroinflammation. So in many ways, positively, it helps with enhancing plasticity. You have this increase of what's called IL-1 and IL-4, but it's low signaling and it helps with development, memory, and learning. Or you might have an injury and IL-4 goes up to help with remodeling. And so those are okay, or just for communication, immune to brain communication and surveillance. So on some levels to help reprioritize of host priorities, enhance plasticity, ability to have repair of the tissue, all are positive aspects of neuroinflammation. But there are negative aspects, again, based on the intensity and duration. So a traumatic, like a TBI, you'll have this increase in IL-1, high level tumor necrosis factor, ROS is impacted, and you actually have collateral damage. And then when you have a chronic medium level of inflammation, you'll see things like anxiety and depression. And then if you have chronic low inflammation, which is called like inflammation over time, you have an increase up of things like IL-1 and IL-6, which cause issues with neuroinflammation. And then neurodegenerative disease, obviously you'll see much higher levels of things like IF1, interleukin-1 rather, tumor necrosis factor, as well as interferon. So what happens is you have this dysregulation of neuroimmune signaling. And because of this chronic activation of microglia, that can lead to activation of just many cascades. So you have this intracellular cascade as a result. You have production of both pro and anti-nociceptive factors. You have neurotransmitters that are impacted like glutamate and GABA, purinoreceptors, adrenoreceptors, cholinergic receptors. You have receptors for hormones and modulators like histamine. Histamine is actually considered an excitatory neurotransmitter. Substance P related to pain. Also, this change in interleukins, IL-1, 5, 6, 8 to 13, interferons, and tumor necrosis factor. And you'll also see PAMP, TLR9 also implicated as part of this intracellular cascade. So, what is the impact directly on inflammation, on neurotransmission, and neurocircuits? So, they basically play a role in peripheral immune function and allows for what we call immune cell recruitment. So, bringing immune cells to the area due to inflammation. And what happens is inflammation actually decreases the release of dopamine. And we'll talk about those neurotransmitters more, but it decreases the release of dopamine as well as connection between both the prefrontal cortex and what's called the ventral striatum. So prefrontal cortex, as we know, is related to making decisions and part of our development. So this is why they have some studies. As we know, children can develop in their brain up to the age of 26, particularly the prefrontal cortex. So if there's chronic inflammation before that age, it has been implicated also for increased rates of mental health or increased rates of even things like violence and aggression and things like that as well. So dopamine, for a lot of people don't know, actually has an anti-inflammatory effect on the microglia. And what you'll see with chronic inflammation, things like IL-10 will go down. IL-10 is actually an interleukin that helps to enhance dopamine levels and is also anti-inflammatory. So some of them are more pro-inflammatory, like IL-1, IL-6, but things like IL-10 are actually anti-inflammatory, and it helps with enhancing the dopamine level. So that will also go down with inflammation. You'll also see this altered glutamate and GABA balance. So GABA is an inhibitory neurotransmitter. It helps with anxiety. It's protective for the brain. Glutamate, we need to some levels, but on a high level, it's an excitatory neurotransmitter and will actually be more inflammatory to the brain. And what you'll see is that GABA is neuroprotective, as I mentioned, and the GABA levels will start going down. And this deficiency can actually contribute to prolonged inflammation because it's playing a protective role. Also, TNF, tumor necrosis factor, interferon, IL-6, also all of those inflammatory markers also have shown to increase up glutamate concentrate. And I just mentioned glutamate being an excitatory neurotransmitter and more inflammatory in nature to the brain, which will trigger things like anxiety and depression. Okay. So what you have is these changes in neural connectivity and plasticity. You have these pro-inflammatory mediators needed at low levels for hippocampal synapses, which is related to brain and memory. You have this imbalance overproduction, which impairs brain neural activity. Things like IL-17, interferon gamma, IL-1 beta, they cause impairment and disconnection of the network. They're more pro-inflammatory. And then you'll have things like IL-4 and IL-10, which actually help to rescue synaptic plasticity and also help to restore the brain and are anti-inflammatory. There's changes in this balance of neurocircuitry. And also a dysfunction in mood related to hippocampus. So what is the relationship between autoimmunity and psychiatric conditions before we break it down by psychiatric conditions? Okay. So autoimmune disorders have shown are more likely to cause psychiatric disorders, primarily when you look at lupus and MS. And those with a family history have even a greater increased risk factor. So for me, I have a family history of lupus, rheumatoid arthritis. People who have family history, autoimmune condition, much more likely to also be at a predisposition for mental health issues, or obviously also autoimmune conditions. And possible mechanisms include a shared genetic risk factors, infections, and also the role of the microbiome. So you have these autoantibodies that cross-react with these brain antigens. They've shown autoantibody cross-reaction causing schizophrenia. There's elevated levels of inflammatory markers that have been found in the cerebral spinal fluid. So they've shown elevated levels of C-reactive protein in the blood of patients with psychosis, and they've shown that higher rates of these inflammatory marker, CRP, has been higher in the first psychosis or relapse event. So these inflammatory markers, particularly CRP and IL-6, going up before a psychotic event. And studies, as I mentioned earlier, have shown a correlation between inflammation in childhood and increased risk of psychosis in the future, and that higher inflammatory markers have also shown to have decreased treatment resistance. So if someone has a lot of inflammation, high levels of CRP, autoimmune conditions, they may be more resistant actually to anxiolytic, antidepressants, actually psychiatric medications, where you'll see, and you guys have seen, where they need to be put on two, medications for psychiatric conditions, or their dose needs to keep going up, and you're working with them. They're having a lot of inflammation or chronic disease or autoimmune conditions, and that have not been managed. And as those get worse, you'll see there's a lack of or increased need, for example, to be on higher levels of psychiatric medications as a result. And meta-analysis risk of autoimmune disorder has shown, again, increased risk if there's been a previous psychotic disorder as well. So this is just, I'm going to go through, this is just a pictures schematic. I'm going to go through this quickly and how that trigger occurs. We have that on the bottom left, the trigger factors. We have this immature B cell, that the activated B cell occurs. We have then the T helper cells that kick in, and you have these plasma blasts that get developed into then plasma cells. And these plasma cells related to autoantibody development, these antibodies enter into the CNS. And then here you'll see this close association with psychiatric conditions and inflammatory cytokines, including IL-1. These are the most important ones: IL-1, IL-6, tumor necrosis factor, and interferon. You can see microglia and astrocytes during acute stress versus during chronic stress. The first step is you have peripherally released inflammatory cytokines. You have the microglia that get activated, and then your body kicks in to control inflammation. That's a normal process under acute stress. But if you look at the right, it's an overactivation of microglia. So just not just activation, but overactivation. And what you'll see is this decrease in things like 5-HT, which is related to serotonin. So decrease in serotonin, decrease in norepinephrine, decrease in dopamine. And then this HPA acts as hyperactivity. And then also you'll see increased glutamate levels, which I mentioned are higher excitatory levels to the brain, which also is going to impair the plasticity of the brain. So that's when you'll see memory and cognitive issues and things like that as well in individuals with anxiety and depression. So let's look at the contribution of inflammation to psychiatric conditions. So we have on the top, and you could keep going here. Yeah, because it drops. Okay. We have the inhibitory neurotransmitters and the excitatory neurotransmitters. So inhibitory ones, the biggest known ones are GABA and serotonin. These just show what they're synthesized from prior, and glycine as well. And then on the right side, and so those help with things like anxiety, typically. When you look at excitatory transmitters, you see histamine, which is one, and that's why you might see a change when the season changes, where an individual will have more anxiety, and that when in the spring season, and a lot of that could be related to high histamine levels. Glutamate, which is a precursor to glutamine, and one of the reasons someone does have high glutamate levels, being mindful of glutamine and the dosage. And for some people, they can actually get more anxious. So, and that could be one of the reasons, because their glutamate levels are already really high, which can cause more brain cell damage. Norepinephrine is a precursor to dopamine, which is synthesized from tyrosine. So amino acid tyrosine is helpful when you look at things like supporting of dopamine. And then you see dopamine synthesized from phenylalanine. So on the top, you see just the steps: phenylalanine to tyrosine to L-DOPA, and then dopamine, norepinephrine, and epinephrine, those catecholamines. And so when you look at depression specifically, the key factors are increased levels of tumor necrosis factor, in the hippocampus, which is the memory center, as well as striatum. You'll also see IL-1 beta as decreases neurogenesis. So that's why a lot of people with depression, you'll see this lack of motivation, a lot of forgetfulness, cognitive issues. So neuroplasticity, neurogenesis actually gets worse. And also the changes with TNF induce the release of these cytokines that activate microglia, which cause damage to the surrounding neurons. So this is just the schematic again of depression, of what it looks like on the left side in the system, how it causes in the middle blood-brain barrier disruption, and then what gets impacted. So we have the hippocampus, I mentioned the ventral striatum, and we have this increase in IL-1 beta, decrease in neurogenesis, increase of TNF, and TNF alpha actually will cause the release of glutamate, and which then actually causes neuronal death. And TNF has been shown to correlate with future depression. So high levels of TNF alpha have been correlated because of the increase in glutamate, and neuronal death have been connected with depression levels. Also, patients with depression have increased immune activation, treatment resistance, as we talked about earlier, and studies most connected for depression are related to inflammatory conditions, including IBDs, inflammatory bowel disorders like Crohn's disease, ulcerative colitis, asthma, RA, diabetes type 2, and also things like cancer. So one of the things that gets implicated, the kynurenine pathway, which is linked to neuroinflammation, and pro-inflammatory cytokines actually promote the kynurenine pathway. And what you have is this, and people can check for this when you look at things like an OAT test. Well, you'll see Quinn go up, 3-HA, and these are all factors for neuroinflammation because you have this, it exerts basically these neurotoxic effects on the brain and oxidative stress, which causes thereby neuroinflammation. And now with depression, the areas that are affected are what's called the anterior cingulate cortex, the prefrontal cortex, and hippocampus. And overactivation of the microglia in the anterior cingulate cortex, as well as the prefrontal cortex, actually also reduce motivation. And studies of MRIs for individuals with depression have shown reduced cortical thinning, or actually, yeah, reduction in cortical thinning, and also even a reduction in the gray matter of the brain. And for anxiety, fear and anxiety actually impact the amygdala. So amygdala is related to that, like that immediate fear and emotional response. That if somebody upsets you, that immediate evoked response that you have, and also affects the anterior cruciate ligament and also the memory center as well. And so anxiety, chronic stress suppresses the hippocampal neurogenesis. And remember, hippocampus related to the memory center. It also, amygdala is impacted again, hippocampus, insula, and anterior cingulate cortex, which is also implicated with depression. And chronic stress impacts the HPA axis as well as the ANS, autonomic nervous system, which causes systemic inflammation, and insufficient levels of cortisol can no longer inhibit corticotrophin releasing hormone, which thereby then activates these inflammatory mast cells and also stimulates the release of norepinephrine. So that's again that flight or fight release, the catecholamine release. And with anxiety, you have also decreased IL-2. You'll have a decrease in IL-4. And I mentioned IL-4 and IL-10 as being what? As being anti-inflammatory. So those actually get decreased. And you also have an increase in tumor necrosis factor, like you'll see with depression, which is also a hallmark of those two disease conditions. And also studies have shown a CRP increase followed by IL-6 has been connected with generalized anxiety disorder, panic attacks, as well as things like agoraphobia. Now, with schizophrenia is more connected with like the dopamine balance. And so chronic neuroinflammation has been associated with schizophrenia, mostly because of dysregulation of the dopamine system. You have this altered metabolism of tryptophan, altered synthesis of both GABA and glutamate. And they have shown, again, the first psychotic episode, there's a decrease in IL-10, which I mentioned earlier. IL-10 helps to increase up dopamine. So now you're seeing this decrease in IL-10 and then this increase in IL-6. So there's these lower levels of dopamine. And also IL-1, IL-6, IL-1 beta, tumor necrosis factor. These have all been connected with higher risk of subclinical psychotic symptoms. So this is just the redox dysregulation, how oxidative stress, the balance between glutamate and dopamine, and also mitochondria is very important to balance with a patient, any patients that your clients that you're working with, making sure plenty of antioxidants because of this increase up in inflammation and that balance between both altered glutamate and GABA, as well as reduction in dopamine, which helps to protect the brain. So with schizophrenia, as I mentioned, you're going to see a higher level of oxidative stress. NF-kappa B can be activated, COX-2, MMP9. MMP9 has also been connected with like rheumatoid arthritis and cartilage issues. Pro-inflammatory cytokines include concentration of chymeric acid, which I talked about, which is actually an antagonist of what's called NMDA receptors, and connected with neuroinflammation. You'll have a reduction in glutathione levels, and you'll also have negative symptoms that can be correlated, again, with dysfunctional glutamatergic pathway, and glutamate helps to be modulated by the NMDA receptors. So what are some of the important inflammatory biomarkers? So if you're working up this case, think someone has neuroinflammation and you want to look to see how to manage and monitor it. The ones that have been most studied are these here below. So CRP has been shown as a definitely increased risk with treatment resistance, with before a psychotic episode, and for the management of a psychiatric condition. So CRP is one, IL-6, IL-10, IL-12, tumor necrosis factor, interferons. But again, CRP, one of the most important ones, and has shown to be predictive of depression. So CRP levels in studies that have been greater than 3 have been observed in individuals with depression. So again, I talked about this earlier, so we're going to go through this quickly. Higher CRP levels treated and connected with treatment resistance for individuals with antidepressants, and also poor clinical outcomes for schizophrenia. TNF1 significantly higher in patients with treatment-resistant depression. And you also can have a dysregulation of the JAK-STAT pathways, which is important to note because if someone, for example, has an autoimmune condition, they're on sometimes medications that impact this pathway. And this could cause an issue with increased likelihood of mental health conditions, particularly depression. So now we're going to talk about what do we actually do, which is to me more the fun part. I'm going to talk about herbs and nutrients that are very specific for the biomarkers we talked about, and some studies on environment and lifestyle and how they can actually help. So there's growing research, one factor lifestyle wise, on pollution's impact to induce inflammation, oxidative stress on the brain. The heavy metal exposure has been connected with impacting negatively anxiety. And the ones studied have been cadmium, mercury, lead, chromium, silver, and arsenic, particularly for people that are in urban areas. They've even had studies, people located and living close to a highway, levels of things like arsenic and cadmium being higher, increased for things like autism, even ADHD and anxiety. Things like vitamin E and zinc help to ameliorate anxiety because for people have had heavy metal exposure. So things like vitamin E, zinc, and glutathione. And then also toxic mold exposure. We didn't talk too much about mold because that could be a whole presentation in itself or multiple presentations, but mold exposure is also something to look at environmentally that has been linked to anxiety, depression, and also cognitive effect. So what's the diet and nutrition? So this, I'm just going to give you studies that have been shown and connected to support mental health conditions. So The ones that have shown as really antioxidants, diets that are high in antioxidants, and they've been in connection with implicated, if low, development of psychiatric conditions, omega-3 rich foods, particularly DHA, things with BDNF. So that's what's called brain-derived neurotrophic factors. Helps with neuroplasticity and neurodegeneration, and just overall high intakes of vegetables, fruits, nuts, whole grains, moderate consumption of wine and alcohol. So I'm going to go to the next slide. The ones that have been studied have been, of course, based on that, is like the Mediterranean diet is actually shown to have protective effect on anxiety and depression. There's also a diet called the MIND diet, which is similar to Mediterranean diet, that has been associated with a lower chance of depression and psychological distress, not anxiety though, and also slows cognitive decline, similar to Mediterranean diet, but lower amounts of fish. And also the ketogenic diet. So ketogenic, a lot of people are using more for metabolic diseases and also weight loss, but it's also shown to have effects on both neurotransmitter function in the brain, metabolism, and the balance of the blood glucose levels. Other lifestyles. So things, again, we want to look at everything. What is someone's environmental exposure? Are they in an area where there's, for example, urban area, more pollution? Are there things like HEPA filters and things you could work on their current environment or limit their exposure, or things like vitamin E, zinc, and glutathione to help protect them? Now we look at things like sleep. Sleep, there's a bidirectional relationship. So they have even so much have shown that insomnia during adolescence is a significant predictor of adult depression. So it's huge to know that insomnia puts an adolescence will put an adolescent at much greater risk of depression later in life. And also impairment of sleep predicts development of generalized anxiety disorder also in the future, and also predisposes to PTSD and connection to suicidality, which we know is at a much higher rate for adolescents and young adults. Studies also show, when we look at exercise of 45 minutes, that's more ideal for someone with mental health conditions. 3 to 5 times per week are optimal for mental health. But it also studies have shown there's a U relationship, meaning that if it goes in much excess of that, it's connected to addiction and mental health issues. So you need to be mindful. And also people with tick-borne diseases or infections, they might be less tolerant with exercise, but being mindful of the level, because at a certain point, too high of an amount has been connected with addiction and mental health. And then we look at other factors: increased social connectedness, encourage more positive coping, decreased social support has shown to be an antecedent for schizophrenia. So less social support has been a factor for schizophrenia. Resilience, choosing an environment that fosters growth is a positive factor. Working with your clients and finding out what environment, what living environment, what place that they're living in that actually allows for resilience. And what is their purpose? Are they working in a way that they're having a purpose in life that's been shown to be protective for anxiety, fostering, and also depression and Alzheimer's? And also things like mindfulness-based stress reduction shows increased levels of life satisfaction, empathy, optimism, autonomy, and competence. Also, these are some cool studies on forest bathing and sauna. So this study has shown forest bathing in Japan, a study to forest areas of blood and urine were sampled in days 2 and 3 of the trip. And they actually showed an increase up of natural killer cells to help with inflammation even 30 days after the trip. And sauna, the studies have shown with sauna, there was a study in Finland that studied sauna with over 2,000 individuals, men aged 42 to 61 with no history of psychotic disorders, ranging from 1 to 7 times per week. And what they showed is the increased frequency. There's an established inverse association between frequent use of sauna bathing and CRP levels. So the more frequently an individual, a male in this case, actually used the sauna, the less likely they were to have psychotic or lower levels of CRP, and also future risk of psychotic disorders. And the study showed post-median follow-up for up to 25 years. So they were followed for a long period of time. And also studies had shown that with some other pieces in studies with 45 men and women, and showed improvement in quality of life as well. Questionnaire. This was that study with questionnaires, and they showed improvement in things like vigor, anxiety, and also depression. Studies for cold immersion, they have shown it to increase up norepinephrine and epinephrine, but most of the studies have shown no significant reduction in inflammation or cellular stress, but has shown with some like clinical signs. So clinical symptoms have been improved, not necessarily changes in blood work, but how it works should be helping to support things like dopamine, norepinephrine, and epinephrine. The gut microbiome. So gut microbiome also being impacted with inflammation and the enrichment of tryptophan metabolism pathways, and have shown to be metabolizing tryptophan in gut, and also very specific strains. When you look at things like Lyme disease, Lactobacillus plantarum is one that has been implicated at low levels, has caused continuation of Lyme-like symptoms as well. And this was a cool piece here to just see in schizophrenia. They showed there was marked increased facultative anaerobes in the gut bacteria. So we have some amount, but they have a much increased higher amount. And this was in a study with over 97 adults. So let's look quickly on the therapeutic strategies and anti-inflammatories. So these are the most studied herbs when you look at Lyme disease: Artemisia, Cryptolepis sanguinolenta, Juglans nigra, Artemisia annua, Uncaria tomentosa, which is cat's claw, Polygonum cupsidatum is Japanese knotweed, and Scutellaria, I accidentally put it all the way, but Scutellaria bicalensis, not latiforla, but galensis is shown to exhibit stronger activity than doxycycline, which is the antibiotic most commonly used for Lyme disease, particularly against stationary phase. And also things like oregano have shown to decrease what's called biofilm, and a lot of biofilm is produced with tick-borne infections. Artemisia has shown to be also effective in inhibition of T lymphocyte proliferation, and also has less of an impact on the gut microbiome as compared to antibiotics. So other things, you look at persistent infections. So I mentioned biofilm. So what happens is these infections and viruses hide behind these biofilms with this, which is this like mucosal layer that allows like the spirochete, for example, to hide from the host. So you need to be on things like stevia or oregano, or oil. Things that have been studied have been oregano oil, garlic, clove, that have helped against biofilm, so you're not having this chronic persistent infection. And stevia has also been shown to be comparable in strength to triple combination antibiotics, and also helps to eliminate what's called both log phase spirochetes and persisters. So that's basically a slow growing in terms of allowing the Lyme disease for people that are having it for a longer time, being able to focus on things like the persister cells and log phase spirochetes or stationary form is really, really important. Oh, whoa, it's doing something fancy over there. Okay. Okay, so there's curcuma longa. So curcuma longa turmeric, people know of it just primarily for inflammation, but one thing people do not know is that there have been more studies actually on turmeric used for depression than there has been even for inflammation and for cancer. So the reason being that it downregulates IL-6 and also helps with CRP levels, and it also increases BDNF. And also the studies have shown regular dietary consumption of curcumin produced 4.5 times increase in stress resilience. This is one of the ones I will put women on too that have a lot of like significant, let's say PMS symptoms, because IL-6 will actually go up 3 to 5 days before the cycle. So I might put them on high dose things like turmeric, which can help with things like depression related to PMS. Flavonoids. So as we mentioned before, a diet high in antioxidants, flavonoids, there have been many studies. Here we have 11 studies on helping to help with depression and symptom reduction of only 50 to 100 milligrams per day, with treatment improving it in greater than 8 weeks. Ginger has been studied to help as a favorable profile for 5-HT, which is serotonin. and also helps to not only help with digestion, but it also helps with symptoms of pain and also things like serotonin levels. Keratoconatosis. So I mentioned it for Lyme disease. It also it's antimicrobial, also helps with immune dysregulation. It helps with inhibition of TNF alpha, which are one of the ones in NF kappa B. We talked about implicated in things like depression, as well as borage oil, which has high levels of gamma linoleic acid, which can suppress TNF alpha. And it does that by increasing CAMP and prostaglandins E. Bilberry. So bilberry also lowers TNF, IL-6, and IL-1 beta. So all of the herbs I'm mentioning are all targeted towards those inflammatory biomarkers I mentioned increase up with these disease conditions. Passionflora incarna has shown to modulate GABA. Rhodiola. So rhodiola inhibits also CRP. So we often know of it just as an adaptogen, but it also helps increase inhibiting CRP, inhibits COX-1 and 2, and also it helps with, people don't know, another thing is it helps with norepinephrine and epinephrine. So rhodiola, not only known as an adaptogen and also helping with inflammation, which we talked about, but it also has been studied to help with things like ADHD because of its help with the catecholamines. Next. Okay, so these are some of the others. So I mentioned Scutellaria bacillensis before as an antimicrobial for Lyme disease. We also have Scutellaria latifolia that helps to, it can cross the blood-brain barrier. It helps to target the hippocampus and striatum. And if you guys were listening closely on that part, that it looks like we went to the next slide. The hippocampus and striatum are ones that are more connected. If you can go to the slide before with depression. And so we're looking at that for Scutellaria, or I'm sorry, we're looking at that for Scutellaria latifolia, the first one. Saffron. Saffron's another one that helps with the expression of SIRT1 and NRF2, which downregulate NF kappa B. NAC helps to control the NMDA synaptic receptors. They use NAC a lot too for things like OCD, but also has been shown to be helpful for things like schizophrenia if there's high peripheral levels of oxidative stress. Omega-3 also helps to reduce the CRP levels, and definitely lots of studies on CBD, particularly helping with not only the inflammation, but also 5-HT1 related to serotonin. Berberine. So berberine, as we know, we use a lot of times for insulin and glucose intolerance, but it also helps as an antimicrobial and helps with dopamine dysfunction. So whenever I look at these things, I think great if I also have someone that has, let's say, issues with glucose balance and or diabetes. How do we use things like berberine and they also have mental health issues to kind of get more than one, and even has been studied against things like Babesia and Lyme disease. So has antiviral effects, but it also helps with dopamine dysfunction. Arabinogalactin, one of the ones I love, is a prebiotic and helps to enhance natural killer cells. And then vitamin D. So high levels of vitamin D, or low levels rather, of vitamin D. Vitamin D deficiency has been connected with increased progression of rheumatoid arthritis, lupus, and mixed connective tissue disorder. So if you have a patient that has those disease conditions, vitamin D deficiency for them in particular will show to have an increased progression of symptoms as well. And then things like monolaurin that help with many viruses, including things like Mycobacterium and CMV. These are the last ones. So Lactobacillus rhamnosus, these are all in the gut microbiome. I mentioned Lactobacillus plantarum being studied for Lyme. Rhamnosus has been studied particularly for levels of GABA in the prefrontal cortex, hippocampus, and amygdala. Strep vestibularis, this is not a good one, but high levels have been associated with schizophrenia. And then pre and probiotics have shown to help improve cognition and also just overall homeostasis of the gut microbiome. So in summary, we talked about a lot, but the key thing was, what is the interrelationship between inflammation, immune tolerance, how the blood-brain barrier gets disrupted, how the microglia get activated, which neurotransmitters are implicated like GABA, glutamate, dopamine, which inflammatory biomarkers are the key ones to look at, most importantly, things like CRP, IL-6, IL-1, which ones are supportive, things like IL-10, which help with dopamine. We talked about lifestyle, things like sauna, how to balance exercise, sleep, environmental exposures that could positively or negatively impact a person, and then very key herbs and nutrients that help to decrease not only inflammation but also will help with the neurotransmitters and also the gut microbiome as well. So I thank you, everybody. You can go to the next slide. Thank you, everyone, for having me here. We open to questions. I tried to go as fast as I could within the hour to get through everything. I think it's the next slide. I think it's the last slide. Yep, that's it. Okay, so then that's me. Thank you, everybody, again for this talk. I feel free to contact me with any questions. This is where to follow me on Instagram. Pretty active there. And then I'll bring it back to Joe at Nutritional Frontiers. Thank you.
Wow. Okay. That you went pretty fast, but boy, what a lot of information, Dr. Jaquel. It was just incredible. I think that this is touching more and more people these days. Tick-borne type illnesses. We probably aren't scratching the surface on that. And as far as neurological impact, gut-brain connection. Dr. Len, who you've met, Dr. Len. He showed us an interesting slide the other day of the developing fetus, and it actually shows the gut forming before the brain. So when people say, "Oh, the gut is the second brain," he's saying, "I think it's the first."
Maybe the first brain.
It's the first brain, right? Okay. But the point I just want to make is that tying this all together, neurological, gut health, and you did at the end with those supplements is just incredible. And I think that, as we said early on, neurological disease states are on the rise, and they don't get the press that some of the other ones do. And so this is vital information, bringing this to the public, bringing this to light. And we're open to, I think you should consider a course for our physicians as well.
Oh, yeah, because what I talked about, this could be 6 hours. So, because even just Lyme disease and reading the test and how to interpret the test.
Exactly.
But also the biggest thing is, like, you guys it might have been a lot, but the biggest thing I would say is, like, what markers to look out for. And then also just consider, if you have a patient you're working with mental health conditions and they're just seeming like they the list keeps getting longer, or it's not getting managed. What are the reasons? That's the biggest thing that could be actually causing that to not be managed well. And typically when you look at inflammation is a huge role to play. And if we get that down, how can we then help to support those disease conditions, or hopefully even prevent it, especially in a younger person?
Yep. You're absolutely correct. Inflammation's the key. We knew that for heart disease a long time ago before they brought it to the public eye, right? But it's just there. It's at the core of everything. And systemic inflammation is the one. Remember, they used to call it silent inflammation, right? Chronic or silent, the silent killer. It's systemic because you don't see it until it's too late.
Exactly.
But yeah, so thank you so much for taking time out of your Saturday to be with us. And folks, this presentation, like all of them, will be on the Nutritional Frontiers and World of Wellness Facebook page, YouTube channel. Anywhere else, Phil? Those two. Okay, they'll all be there. They'll be there for you to see at your leisure anytime you want. So once again, thank you, Doc. It was a pleasure.
Thank you.
Bye-bye.